Are you experiencing pain in your big toe, particularly when you try to crouch down on the floor or go up on your toes or when you're out running or hiking? This could be a condition called Hallux rigidus. Hallux refers to the big toe and rigid speaks for itself. When the joint jams in your big toe joint, we can develop Hallux rigidus. It develops a type of arthritis that affects the big toe joint in the first metatarsal phalangeal joint, your big toe joint. Before we talk about treatments, I'd like to introduce myself. I'm Dr. Rion Berg and I've been practicing podiatry for over 40 years in Seattle, Washington. I've also written an ebook called How to Stop Pain in the Ball of Your Foot to help you learn about Hallux rigidus and other types of conditions that can cause pain in the ball of the foot. You can find a link to download it in the description below. If you find this information helpful, please remember to subscribe, hit the like button, and then hit the bell so you can receive a notification every time I release a new video. First, I'll talk about the symptoms of Hallux rigidus. At first, the pain may only occur occasionally when you jam the joint too hard, but as the condition worsens and the joint becomes more rigid, the discomfort will become more constant even during normal walking. Walking, climbing stairs, or engaging in sports like golf, going up on your toes, anything that bends that great toe joint a lot may trigger or intensify the pain. Can cold weather, damp weather, or wearing shoes that are too tight, or shoes that are too flexible and jam the joint too easily. Other symptoms of Hallux rigidus are stiffness in the joint. As it progresses, it gets stiffer as the arthritis progresses. Swelling around the joint. Reduced range of motion in your great toe joint. You may also see a bump similar to a bunion, but that occurs on the side. In this case, it's on top of your big toe joint, and it usually indicates a more advanced form of the condition. So what causes Hallux rigidus? Well, as we said already, it's the jamming of two bones in your great toe joint. And as we age, the alignment here can change such that the cartilage wears down, and it increases the likelihood of further erosion, getting bone on bone, and a rigid great toe joint and arthritic pain. Other factors that raise the risk include faulty foot mechanics like flat feet, overpronating the foot, and jamming the joint. Overuse of the joint can occur from participation in sports or standing for long periods of time on the job. Previous injuries to the toe, such as stubbing or turf toe from athletic activities, can certainly add to the problem. Having an extra long bone in your foot can add to the problem. Health conditions like rheumatoid arthritis or gout or an autoimmune disorder, and certainly obesity, can add to the problem. People over 50 and women are more likely to develop Hallux rigidus. To diagnose your condition to determine how far it's progressed, I'll test your toes' range of motion, take x-rays, watch you walk, and if caught early the condition, we call it Hallux limitus. It has a limited motion, but not jamming all the way. That's when the toe has some diminished movement, but is still relatively treatable. However, if left untreated, it may progress to the rigid stage, where it can be more difficult to manage with conservative treatment. Now for treatment options. In the early stages of this condition, we'll treat it by using the following conservative measures. First, we use orthotics to control your foot mechanics and alleviate your pain. This is especially important when the faulty alignment, like the flat foot problem, causes jamming in that joint. I'll recommend ice packs and contrast baths for the inflammatory phase of the problem, and this is done temporarily up to a few times a day to alleviate discomfort initially. Be sure not to use extreme temperatures if you use this treatment. Foot will respond better to ice than to heat when it's inflamed. You can take pain relievers and anti-inflammatory medications to further reduce swelling and discomfort if your doctor approves it. If the intensity increases past that, a cortisone injection into the joint, done once in a blue moon, can help relieve inflammation and pain if the regular pain relievers aren't that helpful. Finally, I'll recommend wearing shoes with a wide toe box and a rocker bottom, or shoes that have more rigid soles. And you may find on your own that those will give you more relief than things that flex too easily. Your shoe store or shoe repair shop may have carbon graphite insoles that stiffens the sole of the shoe and prevents the joint from jamming. In more advanced cases, surgery may be necessary. The choice of procedure depends upon the severity of the condition your age and activity level. Recovery time will also depend on the specific surgery recommended. While you can't stop hallux rigidus from developing, you can slow its progression. You should intervene early. Avoiding wearing shoes with a tight toe box, heels, and too flexible will all reduce pressure on your toe joint. Be sure to wear your orthotics all the time if you receive them as part of your treatment plan. They will help to keep your feet in proper alignment and reduce stress on your big toe joint. Rest after physical activity and avoid playing through pain. Keep your toes mobile by doing foot and toe exercises. I'll put a link in the video above. In conclusion, while having hallux rigidus can be a challenge, fortunately there are many treatments and modalities available to lessen the impact on your activities and keep the condition from progressing. If you'd like to be notified about new foot health videos, please remember to subscribe, like, and hit the bell.